Hello everyone, today I will make your concept clear on the topic of kidney involvement in various systemic disorders. Okay, these topics are very important. Okay, so in the systemic disorders, the very important topics are diabetic nephropathy. Okay, so this diabetic nephropathy, systemic lupus erythematosus, and hypertension. Okay, if you learn them from your MBBS journey, you can make your concept clear on these topics. Okay, and it will help not only in your prof examination as well as in the entrance examination. It will be very helpful. Okay, so if you have clear your concept, it will be helping in every point. Okay, either in your clinical side or in your PG entrance. Okay, so you don't have to take any worry about entrance. So we should start our topic from diabetic nephropathy. Okay, so this diabetic nephropathy. Okay, in the diabetic nephropathy we have to know the gross and the microscopic features. So this diabetic nephropathy. Okay, so in the diabetic nephropathy the kidney is most commonly affected. Okay, so this diabetic nephropathy is occurring due to diabetes mellitus. Okay, first the person have the diabetes mellitus, then these diabetes mellitus are classified as type 1 and type 2 diabetes mellitus. So among them, type 1 diabetes mellitus is most commonly affect the kidney. Okay, then the type 2 diabetes mellitus. Now the development of this diabetic nephropathy from diabetes mellitus depends upon the duration of the diabetes mellitus. Okay, how long the person has the diabetes mellitus. Okay, so in the gross features we have to know the very important feature, that is renal papillary necrosis. Okay, so most common finding in diabetic nephropathy is renal papillary necrosis. Now there are other disorders in which you can see renal papillary necrosis. So what are the other disorders that we have to know, because the questions are also asked what are the causes of the renal papillary necrosis, and five options are given. You have to choose among them. So that some other disorders like sickle cell anemia, obstructive uropathy, diabetes mellitus. Okay, now analgesic use. Okay, so here are the four causes of the renal papillary necrosis, but the most common cause of the renal papillary necrosis is diabetic nephropathy. Okay, now apart from gross features we have to know the microscopic features. So in the microscopic features the questions are asked like the point wise. Okay, like the earliest finding in the diabetic nephropathy. Okay, that is the thickening of the capillary wall of the glomerular basement membrane. Okay, thickening of the capillary wall or the glomerular basement membrane. Okay, so there is thickening of these walls. I will show the. So these glomerulus, you can see the glomerulus is not looking normal. Okay, it is appearing more thickened. Okay, more thickened. So there is thickening of what? Glomerular basement membrane, as well as these capillary walls are also thickened. Okay, as well as these capillary walls are also thickened. Okay, there is thickening of the capillary wall or glomerular basement membrane. Now next finding is the most common finding in the diabetic nephropathy. Earliest finding will be the thickening of the capillary wall or glomerular basement membrane. Similarly, the most common finding in the diabetic nephropathy is diffuse glomerulosclerosis. Okay, there will be diffuse glomerulosclerosis. Now next will be nodular glomerulosclerosis, that is also known as Kimmel-Still-Wilson nodule or lesion. Okay, Kimmel-Still-Wilson nodule, and these Kimmel-Still-Wilson nodules are the pass positive nodules of sclerosis. Okay, these are pass positive, means they can be stained by the pass stain, periodic acid skip stain. Okay, so they can be stained by the periodic acid skip stain, and these are the nodules. Okay, these are the Kimmel-Still-Wilson nodule. Okay, these are the Kimmel-Still-Wilson nodule. These are only the pinkish materials deposition. Okay, these are the pinkish materials deposition. Okay, now these nodular glomerulosclerosis. After that there is fibrin cap and the capsular drop. Okay, fibrin cap and the capsular drop. So these are the what? These are the capsular drop. You can see here the pinkish deposition. Okay, drop like pinkish deposition. This is known as capsular drops. Okay, now in this figure you can see this is the fibrin cap. Okay, this is the fibrin cap. Okay, in this figure you can see this is the fibrin cap. Okay, so this one will be the capsular drop. Capsular drop means, what do you understand by capsular drops? Capsular drops means there is excess hyaline in the Bowman's capsule. Okay, excess hyaline in the Bowman's capsule, whereas excess hyaline in the capillary wall. Okay, capillary wall. Excess hyaline in the capillary wall is known as fibrin cap. Okay, excess hyaline in the capillary wall is known as fibrin cap, whereas excess hyaline in the Bowman's capsule is known as capsular drops. Okay, now, so these are the important microscopic findings. These are highlighted. These are very important. Okay, so next we have some important points, that is pink material. Okay, pink material means the pink material. You can see in this figure also, you can see the pink material. Okay, so these pink materials are seen in microscopic findings if there is deposition of three main things. Okay, one will be the hyaline deposition, sclerosis, as well as amyloid protein deposition. If there is hyaline deposition, as we know, this is fibrin cap as well as capsular drop. These are the hyaline deposition, and due to the hyaline deposition, you can see this is the capsular drop, that is the hyaline deposition on the the Bowman's capsule, whereas this is the fibrin cap, hyaline deposition in the capillary wall. Okay, so these are the pink materials, so they will appear pink if they are deposited. So if there is sclerosis, there will be pinkish material deposition. As we know, in the diabetic nephropathy, there is diffuse glomerulosclerosis. Diffuse means all the glomerulus are affected. Glomerulosclerosis means the sclerosis of all the glomerulus of a kidney. Okay, so there is diffuse glomerulosclerosis. Now nodular glomerulosclerosis means in the form of nodules they are sclerosed. Okay, next we have here diffuse glomerulosclerosis. So if there is deposition of the amyloid protein, you can see there will be pinkish materials, and this amyloid can be differentiated from sclerosis as well as hyaline deposition by the use of Congo red stain. Okay, Congo red stain, and it will give apple green birefringent. Okay, now we are moving next, that is the next systemic disorder, that is systemic lupus erythematosus. Okay, now WHO has given 6 grade for this systemic lupus erythematosus. Okay, it affects the kidney, so it is known as lupus nephritis. Nephritis means inflammation of the nephron. Okay, lupus means it is related to the SLE, systemic lupus erythematosus. So lupus nephritis means it affects the kidney, and WHO has graded it into 6 grade. Okay, it can be read as grade 1, grade 2, grade 3, grade 4, grade 5, and grade 6. Okay, we have to know the features as well as names of these gradings. Okay, minimal mesangial lupus nephritis, it is the least common type of lupus nephritis. Next will be mesangio-proliferative lupus nephritis. Okay, third one will be focal proliferative lupus nephritis. Grade 4 is diffuse proliferative lupus nephritis. It is the most common type of lupus nephritis. Okay. Grade 5 is known as membranoproliferative lupus nephritis. Now grade 6 is dense sclerosing lupus nephritis, and in this type the kidney cannot work completely at all, means there is complete failure of the kidney. PGN means diffuse proliferative glomerulonephritis or lupus nephritis. Don't be confused, it might be lupus nephritis or glomerulonephritis. Okay, now there is a special term known as wire loop lesion. Okay, that is known as wire loop lesion. So this is the wire loop lesion, means in the form of wire, it will arrange in the form of a wire. Okay, so capillary wall, it will be arranged, capillary wall will be arranged in the form of wire. You can see these are the in the form of wires. Okay, so they will be arranged in the form of wires. So that is wire loop lesion, and it is more prominently seen in grade 4. Okay, it is more prominently, these wire loops are seen in the grade 4 type of lupus nephritis, and it is known as wire loop lesion because it appears like a loop of wire. Okay, it will appear like a loop of wire, that's why it is known as wire loop lesion, and it is more prominent in grade 4. Now because of thickening of the glomerular capillary wall, they will be more prominent. So wire loop lesion is occurring due to thickening of this glomerular capillary wall. Now another term that we have to know in the systemic lupus erythematosus is the full house effect. Okay, so the question will be asked, full house effect is seen in systemic lupus erythematosus. Why it is called as full house effect? Because it shows all type of immunoglobulins and the complement on the electron microscopy. Okay, if we do the electron microscopy of the specimen, okay, of the lupus nephritis, you will see all type of immunoglobulins. It means it contains IgM type, IgG, IgA type, as well as all the complement like C1q, C3, C4, all the complements will be present. That's why it is known as full house effect. So full house effect is seen in systemic lupus erythematosus. Now next, the very important question that is asked about SLE is, what type of hypersensitivity reaction is SLE? So both type 2 and type 3 hypersensitivity reaction, because it causes both hematological lesion as well as visceral lesion. Okay, so hematological lesion, if the question is asked only about that there is a presence of the hematological lesion, then the type of hypersensitivity will be type 2 only. Okay, but if it involves visceral lesion as well, visceral lesion is present and there is immune complex mediated, then we have to tell it as a type 3 hypersensitivity reaction. Okay, for type 2 hypersensitivity reaction there should be hematological lesion, okay, in the option, but for type 3 hypersensitivity reaction there will be visceral lesion, as well as they will tell it as a immune complex mediated. Okay, so in the option if we have type 2, type 1, type 3 and type 4, as well as there is both options, so we have to choose the both. But among the type 2 and type 3, if we have to choose, the better answer will be type 3. Okay, the better option will be type 3 hypersensitivity reaction if you have to choose among them two. Okay, now what is the cardiac manifestation that is seen in the systemic lupus erythematosus? That is known as LSE. SLE causes LSE, means Liebman-Sachs endocarditis. Okay, Liebman-Sachs endocarditis is caused in this SLE. Okay, this SLE, the vegetation in this Liebman-Sachs endocarditis, the vegetations are present on both the side of the heart surface. Okay, also on the endocardium, but there are other endocarditis like merantic endocarditis, rheumatic heart disease, okay, infective endocarditis. There the vegetations are shown only on one side, okay, or at the line of the closure of the bulb these vegetations are appearing. So we can differentiate these endocarditis. Okay, different type of endocarditis. Now moving to the next type of systemic disorder, that is a hypertension. Okay, so this hypertension is also known as nephrosclerosis if it affects the kidney. Okay, so vessels are become totally hardened. Okay, vessels, blood vessels, these are hardened, that's why it is known as nephrosclerosis, and it is of two type, that is benign nephrosclerosis and malignant nephrosclerosis. It is based upon the blood pressure. Okay, so this benign nephrosclerosis is seen in benign nephrosclerosis, it is seen in the benign hypertension. Okay, now similarly malignant nephrosclerosis is seen in malignant hypertension, and the very important finding in the gross is leather grain appearance. Okay, this is the one of the MCQ. Okay, leather grain appearance. Now microscopically there will be hyaline arteriosclerosis. Okay, but in the malignant nephrosclerosis grossly there will be flea bitten appearance, and the microscopically there will be hyperplastic arteriosclerosis. Okay, so this in the case of benign nephrosclerosis there is hyaline arteriosclerosis, so there will be pinkish material deposition in the vessel wall. Okay, and it will lead to narrowing of the blood vessel. Whereas in malignant nephrosclerosis there is a hyperplastic. Okay, hyperplastic means there is a hyperplasia, so there will be laminated thickening of the blood vessel wall. Okay, so it will lead to onion skin appearance of the blood vessel wall. Okay, onion skin appearance of the blood vessel wall, that is also important MCQ. So this is all about the various systemic disorder that involves the kidney. So this is very important topic. You have to read these ones before attending the PG entrance or your MBBS prof exams, and it includes very important high yield points. So I think this, if you like, please subscribe the channel as well as share among your friends. Okay, thanks.